Hello everyone, my name is Chhim Chamroeun. I'm a year 5 student at University of Puthisastra, Cambodia, and I am majoring in dentistry. And my partner.
My name is Chihan, and I am also a year 5 university student at Puthisastra, and I am a co-presenter.
And we are really pleased for getting the chance to join this conference. The topic of our research poster is infection risk and the corresponding needs to implement preventive measurement in dental office in Cambodia, which was conducted under the supervision by Dr. Anand Marya and Dr. Rithvitou.
Our country is famous by its unique culture such as Angkor Wat Temple, the beautiful beach, and nice mountain view. The University of Puthisastra is located in Phnom Penh, which is the capital city of Cambodia.
As we all know that oral health professionals are at high risk of potential infection with the COVID-19, especially while carrying out an aerosol generating procedure such as drilling, ultrasound scanning, and so on other procedures. As the dental health professionals are classified in a very dangerous category of contact, according to the Occupational Safety and Health Administration, as dentists working in proximity to the oral cavity of the patient, so the risk of getting infected by the COVID-19 are very high. About the objective, the study was conducted in Cambodia with an aim to analyze the risk of infection as perceived by dentists and the effort made by them to prevent the spread of this highly transmissible viral infection. And another objective was to understand the attitude, knowledge, and practice of dentists in Cambodia toward implementation of infection control measures.
From the method of collecting the data, we use Google Form to create the questionnaires and survey the dentists in Cambodia on their demographics, their risk perceptions, and information on measures for protection against COVID-19 and see how many of them are aware of these pandemic situations. The questionnaires designed based on previous evidence-based research. The online questionnaires contain demographic information about their qualifications, type of jobs, where they practice, and for how long. We sent the questionnaire to 130 dentists. 102 of them replied, with the response rate of 78.5%. Among 102 dentists, 92.2% are the age group of 20 to 30 years old, and 5.9% are 30 to 40 years old, and only 1% are 40 to 50 years old. With the last group of people aged above 50 years old, only 1% and 66.7% are male, and 33.3% are female.
According to the results from our research, as we can see from the pie chart, most of the dentists think that they are at high risk of getting infected by the COVID-19, which equal to 93.1% of the dentists who replied back to our questionnaire, and 5.9% think they are at medium risk, while only 1% think they are at low risk. And according to our participant answer, during this pandemic period, there are 48.5% of dentists have been practicing, and 39.6% are not practicing, and there are only 11.9% that are not sure about they should continue practicing or not during this pandemic period. According to the data from our research, we found that 88.2% of our response they add new measurement to control the risk of COVID-19 infection. 4.9% haven't add new measurement to control the risk of COVID-19 infection, and The other 6.9%, they are not sure about their clinic have added new measurement or not. During this pandemic period, there are 38.3% of our participants have added new instruments to the clinic, and 21.8% of them have not added any new instrument, while the other 9.9% they are not sure about they have added new instrument or not to their clinic.
We asked, are the new instruments autoclavable or disposable? The answer is only 11% disposable and 31% autoclavable, and the 58% did not add any new instruments. When asked any device added, 81% added UV lamps as it is effective in killing bacteria and virus, also affordable in Cambodia. 11% use atomizer, 8% use HEPA filter, and 1% use fumigation devices. For the statistical analysis, we use SPSS software and the method using Kruskal-Wallis.
For the significant finding, we set the p-value at 0.05. After we do statistical analysis on question, have you added new measurement to help control the risk of COVID-19 infection? It shows significant difference among the group. As we can see that most of the dentists have added new measurement to help control the risk of COVID-19 infection, and most of them from both private clinic, like we have 85.4%, and university clinic, we have 88.7%, while there is only a few of them that have not added any measurement to their clinic for prevention the COVID-19 infection. And we also can find the significant among the group in the question, have you added new instrument to the clinic during the pandemic period, which most of its type of clinic have added new instrument to the clinics, and can see in the table that 70% from private clinic and 69.8% from university, they are all have added new instrument to their clinic during this period. And as you can see that there is only a few percent that have not added new instrument to their clinic. So we can see the difference between this group.
For the questions, how long do you think you will need to use these measures? It has a significant difference as most of the private clinic practitioners are not sure, and over half of the university clinic dentists said about 2 years. After the study, we found that most of the dentists are aware of the pandemic situations, and they understand that in dentistry there are very high risks. However, high percentage of dentists also keep practicing during this pandemic period, as in Cambodia there are not much infection going on. But as of now, the countries are going on lockdown because of the surprisingly high number of infection. However, this study is done before the lockdown happened. Moreover, 88.2% of the dentists are putting new measures in their practice. 68.3% add new instruments, and up to 90% use UV lamp for sterilization of treatment areas, as it is affordable and effective in killing the virus. High percentage of the dentists are also not sure when the situation are going to be better. Moreover, we found that 85.1% of dentists are following the 1 meter space sitting in their clinic, and some of them adding new consultation methods such as online and telephonic. It is very important for educate both the dentists and patients. While we can see that most dentists are aware and able to take measures and preventions, patients also important to know all these measures and prevention in order to make both care provider and the care receiver safe. We thank you for your attention.